IVM.
Hello and welcome to the Habit Coach podcast. I am Ashdin Doctor, your habit coach, and with me today for the second time we have Dr. Aggarwal. If you have missed the first episode, please don't forget to go and listen to it. It was an absolutely brilliant episode. He's a fantastic doctor whose approach is so different and so unique, where he's not talking about adding fear into your life about COVID-19, but understanding about how we can live together with it and how do we understand it and look at it as something that we can use instead of something that we need to fear. Doctor, how do you start measuring that first day? So when you meet somebody who then says that, oh, I tested positive at that point of time, I did not know, and then that's when you measure it?
Today testing has no value as far as the treatment is concerned.
Correct.
Testing has a value to prevent infection to others.
Okay.
So therefore, let's say there are three types of people. Asymptomatic, that means the virus comes in the body, gets killed by the innate immunity, and nobody comes to know. That is called asymptomatic, 100% asymptomatic people. That happens during menstruation, pregnancy, and children less than 10 years of age.
Okay.
There the virus may come and you may not come to know.
Wow.
Second group of people will be the virus will enter your body. You will not come to know, but the virus will produce antibodies. After 28 days, you say, oh my God, I have already got antibodies. That means I did have an infection sometimes back, I never come to know. This is the second group of people. The third group of people will be the virus enters the body. It causes release of interferon 1 and interferon gamma. That produces tissue necrosis factor. It will damage the tissue. It will injure the tissue. And that leads to inflammation. And you get fever. You get mild symptoms. They're called mildly symptomatic. And they become all right by a 7th day. The virus disappears by a 9th day. So these are the people who will come back and say, I had fever for 2 days, 3 days, 4 days. They're all right. Then there are people who on third day, they do not show the reaction of first day. They have no symptoms on day 1 and 2. And on third day, they suddenly develops high-grade inflammation because of the release of thymus 1 cells, which causes release of lots of bradykinin, interleukin, and it causes release of PLRP. It releases so many other chemicals, and it causes strong inflammation in the body. That may persist for 3 months.
Okay.
That inflammation may persist for 3 months, but the virus will get in 7 days' time.
Okay.
Now, when you have an inflammation in the body, it has to cause symptoms. So where the symptoms will occur is what your question is. Let's understand some basic mechanisms of Atharveda, which describes Ayurveda through Sankhya philosophy. Sankhya philosophy says the definition of health is some dosha, some dhatu, some agni, malaria. That means in my body they say dosh, that is pitta dosh, and agni are different.
Okay.
So they are describing, in modern medicine we are silent about this.
Right.
So in modern medicine they say there is something called agni, which is called, agni is low grade inflammation in my body.
Okay.
And this low grade inflammation in my body, if you add fuel into it, which is called pitta, it will turn into a major fire. And that will cause symptoms.
Interesting.
Ayurveda describes that there are 5 factories of fire where the fuel material is produced. Therefore, it is likely that fuel will get ignited in these areas before. One is called alochak pitta, which is the eye. So this virus is causing symptoms in the eye. The second is called bhrajak pitta, which causes inflammation in the skin. So we are getting skin manifestations. Then he says sadhak pitta. Then he says pachak pitta. So it is causing nausea, anorexia, diarrhea, small intestinal diarrhea, small intestinal pain. That is called Pachak Pitta. Then it is causing two more Pitta location, that is Ranjak Pitta and Sadhak Pitta. Sadhak Pitta is lungs and heart, and Ranjak is gallbladder, blood circulation.
Okay.
So through Ranjak and Sadhak Pitta, it is causing damage to the blood vessel. And that damage to the blood vessel will predominantly cause damage to these areas, but can cause damage anywhere. So the common symptoms are A, loss of smell, loss of taste, because it infects the inflammation in the nose. That is a local action. Local action is in the nose. Then it can cause eye involvement. It can cause lung involvement, bronchitis, alveolitis, sparing the larynx. It can have complete GI involvement. It can have urinary bladder involvement. So all types of symptoms. Classical symptoms are fever invariably will be there because there is inflammation.
Correct.
So the classical symptoms are fever, sore throat, bronchitis, cough, and breathlessness, loss of smell, loss of taste, and diarrhea. But atypical symptoms are much more common. Asymptomatic, no antibiotics. Symptomatic, asymptomatic with antibodies. Third, mildly symptomatic, pre-symptomatic. That my test is positive, my symptoms are coming after 24 hours.
Correct.
Then I have mildly symptomatic, then symptomatic, then atypical symptomatic. Atypical symptomatic is when there is self-negligence. India में क्या है? There is a self-denial. You say गला खराब हुआ है. नहीं वो तो बर्फ खाली थी इसलिए हो गया. Every time you have a reason for a self-denial. You have a fever lasting for 2 days, only for 2 hours. You say नहीं वो तो बारिश में गया था.
Correct.
बारिश आ रही थी, मैं 5 मिनट के लिए बाहर गया था, इसलिए बुखार हो गया. So self-denial is the cases where patient ends up into a seriousness. Self-denial of transient atypical symptoms. Transient. If they are permanent, if they are persistent, you record for it.
Correct.
Transient atypical symptoms you ignore, and you end up into day 3, and you end up into a crisis.
So as soon as you see even these little hints of it, make note of it.
As on today, anything unusual, anything for the first time, anything which cannot be explained, talk to your doctor.
Okay. Very interesting. Okay. And doctor, how do you think about, like a large sentiment amongst the people right now when I was speaking to them is about complete confusion. And as soon as somebody says COVID-19, immediately in their mind, they feel, I have all the symptoms. Right. As soon as I talked to my friends, they said, I thought I met somebody. They said that they were COVID-19. I'm now feeling all these symptoms. How do you make that, that psychosomatic change different from what is actually happening? No, correct. Third-year syndrome. Correct.
And third-year syndrome is that whatever you read on the third year in medical sciences, you start imagining.
Correct.
To the extent a male will start imagining that they have a uterus cancer, and a female will start saying, I have a prostate cancer today. Without understanding that it doesn't happen. So this is very commonly called as a third-year syndrome. Therefore, correct knowledge is the most answer. You need a sumant and not a mantra. Therefore, I'm saying is correct knowledge is the answer. I am trying to train 1,000 educators. I've done already around 300 of them.
Wow.
So we take every Monday 6 hours course in telling them to spread in the community what the correct knowledge is. Confusion is, there is a height of confusion in the community. But remember also they are looking for a comfort. So whatever a comfort level message comes, it becomes viral. You say, you abhi right away you send a message and say XYZ se theek hota hai. You will find a message. So I am going to send a message today about Kalonji. Kalonji is, which is correct message.
Correct.
Message is correct. But Kalonji is a anti-inflammatory. Kalonji and Haldi are anti-inflammatory.
Correct.
Which is a correct statement.
Right.
But if I said it right away, if I send it as a WhatsApp message, it will become viral.
Yeah.
because people are looking for such messages. But if done correctly, they are fine. But if there is something wrong into this can create a fear also.
Right. In fact, if we say that this is for inflammation, not as a medicine and a cure, as soon as you get into that, it then becomes misinformation. Yes, but the actual aspect is, of course, haldi is damn good for you.
Nowadays, we are talking about anti-inflammatory lifestyle. Because inflammation, see, I'll tell you one thing. This COVID-19 will reduce the number of heart attacks in the country in the next 5 years.
Yes.
Will reduce the suicides, homicides. It will reduce paralysis. All this will get reduced because they all are inflammatory diseases. Because now everybody will start talking about an anti-inflammatory lifestyle.
Correct. And that's the beautiful thing about this, it's made us aware about all these health concerns. I remember, in one of your videos, you always celebrate it, right? You're saying that thank you for coming. You're showing us this way. Like you were talking about washing vegetables, I think, in one of the videos. And you said that not only will you not get COVID, now you won't get all these other waterborne diseases also. Absolutely. And finally, it's teaching us how to take care of ourselves. It's teaching us how to interact with people socially. Like I was telling my parents, because they are still staying on the farm. They haven't interacted with anybody. And I was telling my parents, I was like, do you realize that social systems are going to change from now onwards? Every time somebody comes to meet you, there's going to be a different social system. You might have special rooms for people who come in so that they can change or whatever. And that's an interesting future that's going to be created because of this. And I think, it's seeing 4 years down the line, 3 years down the line, because clearly it's not going anywhere. We have to live along with it. And how do we do that is, I think, going to be the next steps.
And when you say it is not going to go, I don't want it to go.
Right.
Because if it goes, 2020 will come. COVID-20 will come.
Correct.
Because COVID-19, if goes, COVID-20 will come. Yeah. And if COVID-20 comes, COVID-19, now we have handled it for 6 months. And COVID-20, how it is going to behave, we don't know.
No.
So let us all, today we can't say this is an unknown virus. It's 6 months. You have known him. You have married him for 6 months. Now you can't say I don't know him. You know enough about the virus today. And today, if treatment is started early, death should not occur.
Should not occur. I love that statement.
Yes.
Don't fear the death. Just do everything as per the book, as per what you were saying. Precaution more than anything else is more important.
Early treatment. Even if it is at home, you don't require admission in most cases. If you start your treatment early as a home isolation, even hospitalization may be avoided.
And doctor, is there more information keep coming out for you also at your level about the virus? Like saying, oh, we didn't know this. Oh, we didn't know
this. Every day we are learning.
Oh, wow.
Every moment we are learning. Wow. And I'm taking minimum, so today I have 8 hours of sessions. This is my 4th session I'm taking.
Wow.
Then I have a session at 2 o'clock, 4 o'clock, 5 o'clock, 8 o'clock, 7 o'clock. So every day I'm 4 to 8 hours, I'm interacting with people, I'm learning every moment. And that's the reason I said I have a Vedic student for the last 4 decades. I'm learning every day.
Doctor, you're absolutely amazing. Next time we have to do one entire video on your energy and how you do all this. My God, it's mind-blowing. Superb. Doctor, before wrapping up, how do you see the future coming up? What do you see? Because like a lot of people are saying that we will wait. And I keep saying, what are you waiting for? How is the world going to change according to you if you had to put your future thinking hat on?
Change is always for a good.
Absolutely.
The needs will come down. The psyche of the people will change. The type of fear, type of cynical behavior, everything will go down. The rat race will go down. Our needs will come down. We will be more calm. The stress level in the families will go down. I think 50% of the people will still opt for working from home. That culture will come back. People now will be working with much more ease, much more time. No jhoot. Now nobody will be able to make a lie that I'm not well. We'll say, okay, if you're not well, come on the Zoom and talk, working with us. So you can't be sitting in Shimla celebrating and saying I'm on a medical leave. So as a whole, change is always for a good. They will have less pollution. carbon emission is already less by 8% world over. We will be less of traffic deaths, less of communicable diseases, non-communicable diseases. I find the future is going to be much better. The hospitals will become cheaper. The hospitals will become much better in terms of spacious. That shosha will go away, that I need a single room, I need a two-suite room in a hospital. Everything will go away. Home care is going to be the reality. Now, 90% of the patients will be treated at home, not in the hospitals.
Doctor, anything else that you want to leave with the listeners today on how they should be approaching this? Anything that you want to cover that we have not spoken about?
I think it's a time to change for the better. Have a family doctor with you. Believe in home care. That family doctor now will be available on a click away. And learn about everything the correct way. Take out the myths, take out the facts, make a plan for yourself. I always say that first calculate, are you at risk?
Correct.
If I am at risk, am I prepared if I get it? And if I get it, am I prepared for the first day? There's three things to do, which is the most important. Am I at risk? Am I prepared that if I get on the first day, and can I tolerate my first day? Because maximum stress is on day one. Correct. If you cross that day one, everything is okay. Suicide, homicide, psychological problems are day one. Right. Remember, the day one is the most important. You need a friend. You need a Suman for day one. Make sure that nothing happens to you. Remember that only 0.3%, 3 out of 1,000 people who get this infection would die. The mortality in a cesarean is much higher than 3 per 1,000.
Correct.
The mortality in an appendix operation is much higher than 3 per 1,000. So live normally, no fear, live a normal life. But that doesn't mean that you are not going to use your vaccines.
Correct.
You have 4 vaccines with you, and that is masking, hand hygiene, physical distancing, and oral hygiene. If you use of these 4 vaccines, so what? At the most, if you get it, treat it as a natural vaccine. That nature has given me a natural vaccine and I'm not going to take care of it. And Correct. Once you get it, stop forgetting about Dubara hoga, Tibara hoga. That's for us to decide, not for you. Live a normal life.
Love it. Thank you so much, Dr. Aggarwal, for being part of our Habit Coach podcast. It was an absolute pleasure. I learned so much and you've completely exploded my mind with the way you think. Thank you so much.
Thank you. Thank you.
I learned so much from listening to Dr. Aggarwal and more from all the videos that he has on YouTube. Please don't forget to go and check out his videos on YouTube. You can just search for his name, Dr. K.K. Aggarwal, Aggarwal, and and you'll find so many videos filled with interesting information. So don't forget to check that out as well after listening to this podcast.
If you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM Podcast app or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcasts on Twitter and Instagram. If you want to reach out to me, I am Ashdin Doc on Twitter and Instagram. You can find lots more information on my website, awesome180.com, or check out different content on my YouTube channel called AWESOME180. That's Awesome180.
I hope you enjoyed that show. I'd like to thank our sponsors this week, Intel. It's been a great week on the network this week. If you haven't been paying attention, please do listen to some of the shows. We had Chetan Bhagat. This was the first returning guest on Cyrus Says. Do check that out. Great episode. We had Palak Zatakia on Advertising is Dead. Really interesting conversation was had with Varun. We had another crossover on the Habit Coach. Zarina Poonawala showed up over there to have a discussion with Ashdin about anxiety and pressure. Begin the Journey with Ashi Vidyarthi continues to kill it. Please definitely do check it out. An old friend, Vijay Koshi, was on Storytellers and Storysellers. Do check that out as well. And I'd like to mention one thing. If you're a Tamil speaker, you should definitely check out our podcast, Kadai Podcast Punyan Selvan. Kavita Jiva has done a fantastic job to finish up her first story. It is the last episode which just came out last Monday. Do check it out if you speak Tamil. It is an incredible achievement. Please do check that out. And with that, hope to see you again next week.
Sachin Tendulkar, Virat Kohli, Don Bradman, and now Cyrus Brocha. Okay, probably not in the right company. I mean, Don Bradman is Australian. But it's called Cyrus Says, a wonderful show about everything. Find the show on the IVM Podcast app, ivmpodcast.com, or wherever you listen to podcasts.